Hi, my name is Jamie Lynn Pagmanwa, and this is my presentation on health promotion of HIV and AIDS. The problem. HIV and AIDS has been an ongoing health concern and epidemic since the early 1980s and still remains to be the most challenging threat to public health worldwide. Africa alone accounts for 69% of people living with HIV and 70% of all AIDS-related deaths. More than 4 in 10 new infections among women are found in young women aged 15 to 24 years old. Factors that contribute to the problem are cultural, political, religion, economic, and a lack of medical facilities. My presentation directly addresses Millennium Goal number 6, which is to combat HIV, AIDS, malaria, and other diseases. Learning needs assessment. First, we want to address the language barrier. We need to determine if an interpreter needs to be present. Then we definitely need to establish rapport and provide a supportive environment. We need to assess the needs and levels of comfort for all ages in regards to sexual activity. We need to assess what do they know about HIV, and we need to assess any barriers in learning information such as reading and their comprehension level. We also need to determine what resources are available in regards to screening and treatment in their community, and we need to prioritize our teaching according to Maslow's hierarchy. The precede-proceed model. There are 5 phases to the precede model: social, epidemiological, behavioral and environmental, educational and organizational, and administrative and policy diagnoses. There are 4 evaluation phases to the proceed model: implementation, process, impact, and outcome evaluation. I have chosen the precede-proceed model because it incorporates a multi-level evaluation, which means you have the chance to constantly monitor and change your evaluation according to your results. This also allows some space to adapt the content and methods of the interventions to their needs. And it is also a model meant for participation and creating a successful health promotion. It is thought that a change in behavior is voluntary, so this gives them the feeling of empowerment and control over their own health. Health promotion model and health education plan. The goal is for women and young girls will be educated about HIV and will know what preventative measures to take to decrease the prevalence of HIV, and they will know what resources they have for screenings and treatments. The behavioral outcomes will be they will express their knowledge of HIV and understand the preventative measures in contracting the disease. They will express their knowledge of using male and female condoms and will teach back and demonstrate how to properly apply the contraceptives. And lastly, they will express their knowledge of the resources that are available to them in regards to screening and treatment. Research. Evidence-based practice articles, number 1, titled School-Based HIV Prevention Programs for African Youth. The study showed that education and prevention programs are seen as the primary way of decreasing the HIV rate. Studies that assessed knowledge, they all reported significant improvements. All the studies assessed attitudes and reported some degree of change toward an increase in attitudes that were favorable to risk reduction. In a study that targeted sexual behaviors, sexual activity was delayed and the number of sexual partners were decreased. In another study that targeted condom use behaviors improved. The results of this review suggested that knowledge and attitudes are easier to change, but the challenge is the change in behaviors. Evidence-based practice article number 2, titled Mixed Methods, Evaluation of a Novel, Structured Community, Based Support and Education Intervention for Individuals with HIV and AIDS in KwaZulu-Natal, South Africa. The study has shown that a community-based peer support group can increase the possibility of seeking treatment. There's a psychosocial benefit when clients are connected with their peers because they can express themselves openly and are more likely to re-engage within their community. Evidence-based practice article number 3, titled Education and Vulnerability, the Role of Schools in Protecting Young Women and Girls from HIV in Southern Africa. The study shows that there's evidence that keeping girls in school reduces their risk of contracting HIV. The relationship between staying in school and HIV has changed over time, and with educational growth, they are more likely to correlate with the lower risk of HIV than before. The findings suggest that schooling for girls will help reduce their vulnerability to HIV. Evaluation. Collect information from the groups of women and young girls who attended the presentation. Keep in contact with the women and young girls who attended the presentation and possibly follow their health. Look at the effectiveness of the quantitative and qualitative data. Evaluate the use of contraceptives. Ask yourself, is there an increase of condom use, or is there no change, or is it the same? Evaluate the rate of HIV transmission. Look at the data to determine if the rate of infection is increasing or decreasing. Way forward. Ongoing and consistent education for women and young girls. Ensure women and young girls are aware of the access they have to medical facilities so they can be screened and receive the appropriate treatment if necessary. Maintain relationships with school teachers, school counselors, and community leaders. Adhere to the precede proceed model. Determine what worked and what did not. Identify ways of improvement, and make the necessary changes that are proved to not be successful. These are my references.